There is some increased toxicity associated with adding idelalisib to the backbone. Idelalisib is associated with a increased incidence of colitis, some pneumonitis, and elevated transaminases. And we did see some of that. It tended to be manageable and did not prevent patients from completing treatment, and it did not compromise the overall outcome. There was also an increased risk of febrile neutropenia, but there were no episodes of fatal infection, and again, this was a manageable side effect. But this was a large international study with investigators in Australia, Europe, the United States, and it was a big effort to get all this done, but it represents an important new option for patients. The study was performed as a registrational trial with adequate information. This clinical trial data will be submitted to regulatory authorities both in the US and Europe for approval. I suspect that this approval will come next year. Idelalisib is already approved both by the EMA and by the US FDA for treatment of relapsed refractory CLL in combination with Rituximab for patients who aren't candidates to receive chemotherapy. So this is an extension of the indication for the drug. I would expect pretty rapid approval.